All right, so, with all this technical difficulties going on, I don't know what to do, but thank you for your patience. Again, Miss Ruffin, thank you for coming on. There's a lot that we talked about off the air that...
I know, right?
Yeah, everything's overheating, shutting down. Man, it's an interesting day, but I'm so grateful that you are here. And I did ask, and I was trying to finish it up, like, what are the different, I know there are different names for mental illness, like you have schizophrenia. And
yes, there are different types of mental illness. If we're talking about schizophrenia, hallmarks of schizophrenia is limited cognition, usually not based in reality. You hear auditory hallucinations, visual hallucinations, things are not here.
Okay.
What a person is seeing is not based in reality. So often interventions are reality testing, helping them to refocus on the reality that they are in. Medication does help as well. Other various psychosis, you have schizoaffective disorder, which is a mixture of mood and psychosis. You also have depression. You have generalized anxiety disorder, which I briefly talked about, which is about excessive worrying. That can turn into panic attacks. You can have a variety of symptoms where anxiety can basically control your life. Increased isolation, a fear of the unknown. It's excessive to the point where it's affecting your daily functioning. There are a lot of the others. There's something called the DSM-5, the Diagnostic Statistical Manual, which medical providers go by to diagnose patients with various disorders. There are over, I think, 200. So there are a lot. But the ones you hear about constantly is what? You mentioned schizophrenia, so talking about psychosis. And it's funny because within that population, a lot of people have this negative label about, especially that disorder. And I have treated a variety of patients with schizophrenia, and they have gone on to live normal, not even normal, but manageable lives. With medication, with a lots of support, they're able to go on and live their life. But getting diagnosed and getting treated, there's so many people that are not diagnosed.
Let me ask you, like, because they are so many, like, how do you know? I mean, I understand, like, when you get sick, you go to the doctor and they ask you, you know, the normal questions. So, okay, let me scroll through and find out, okay, because I think you may have this. But then when they come back and it's like, and then you start adding more symptoms, like, oh gosh, well maybe, okay, scratch that, I think you may have this, but I can't find that one. So, and then, but how do you, I guess it's pretty much.
And there are a variety of evidence that people get diagnosed. Sometimes it's through their primary care provider and they're already being treated.
Right.
They're on psychotropic medication. But their provider may say you need more support. You need to be around a community that can engage with you to give you that, right? That could be helpful. And usually that's a gateway to other support systems or other treatment modalities to use.
Is there like one mental illness that might be like cousins or so close that it's hard to diagnose? You know, like I want to say you're this, but you resemble that. I don't know if because I'm associating with regular, you know, sickness to mental illness.
And that's where a mental health provider comes in. And not just, you know, psychiatrists.
Right.
And going to a psychologist or a licensed therapist that has a legal arm to diagnose. But the first thing really is not, even we just can't even get to the diagnostic part of it. It's just getting through the door.
Right.
It's the scariest part, is saying out loud, I need the help. There's things going on, I need to get the help. To me, that's the first step, is just being honest with yourself. Being honest with yourself to know that you need that assistance, and that it's okay to want that assistance, to need that help. We all do sometimes.
Now, here we go again.
All right.
We got various titles for mental illness, and then you have various. You got the therapist, You got the psychiatrist, you got the psychologist. Like, what are the differences between?
Yeah, there are differences, and it's differences by profession, by training, by treatment. So, for example, psychiatrist, that's a medical doctor, right?
Okay.
They're a medical doctor, but they also have psychiatric training. They went through a residence where they received psychiatric training and psychiatry, right?
Okay.
And they're able to prescribe medication, right?
Okay.
You have what I am a social worker, but I'm also trained as a mental health professional. I have a license to practice psychotherapy. Now, when people think of social worker, they're like, oh, wait, they strictly go to thinking of societal view of a social worker, which is child welfare worker, right? And to note that social workers, we do a whole lot more than just deal with the area, manage the area of child welfare. There are all types of various fields within that we work within.
Okay.
And then you have licensed professional counselors. You have psychologists that also have a training. They're not prescribing medicine, but they have the training in terms of diagnostic training to diagnose somebody. They have that extensive training in terms of psychotherapy and counseling. So really, it comes down to what your needs are and what you prefer. But the first, I think, point of action would be finding a provider.
Okay.
Now, there's a whole ton of resources through Department of Mental Health on the web out there, which I can give the resources for your audience. But the one thing I will say, most people go through their behavioral health line through their insurance because, of course, you're not sure of what your insurance covers, right? So I always tell people if they're getting medical assistance or CBH, community behavioral health, there is a behavioral line on the back of your insurance card that you can call, and they can give you the closest providers to go to that have coverage if needed. Now, if you're having a psychiatric crisis, there are crisis CRCs or crisis response centers that you can go to that are embedded in the neighborhood to get you immediate assistance if that means an inpatient hospitalization, if that's needed. For some people, that may just be that they need somebody to talk to and they need to know, okay, I don't know all the resources that's out there. You can call your insurance and find out so you can know what's covered.
Right.
And it's a variety of different treatment modalities. You can do individual or you can do group psychotherapy. It's really depending on what your needs are. And the only way to evaluate that is to take that first step.
Yes, that's the hard
part. Yes, I know. It's the scary first step.
It's the scary, hard part. I don't know. Like, can you treat me? Will you be able to help me? Do you now? It sounds kind of. Gotta find a word. It sounds funny, I want to say, when you have mental issues and you're sitting up there saying to yourself, well, I'm already crazy, so, are they going to think I'm crazy? Mm-hmm. You're looking at, you're trying to, I guess, psychoanalyze your like, well, how are they going to look at me? That's like you hiring a cleaning person to come and clean your house, but you want to clean your house before they get there because you don't want it to look a mess. Well, let me clean myself up before I go to the person because I don't want them to think I'm crazy. It's not so much. That's the wrong choice of word.
No. That's right.
I think we all. I'm in on words.
Yeah.
And even though you may do things that are not of the norm, that I wouldn't call you crazy. You may do some crazy things, but even if you do have mental issues that are left untreated, I still think that you're not deserving to have a label. You just have.
Yeah, but we also stigmatize ourselves, right? You just mentioned, like, I don't want people thinking I'm crazy.
Yeah.
What's crazy? What's normal?
What
right?
is normal?
What's normal to you? To me, it's very individualized. And it's funny because as you're talking about all of those types of thought processes, those thoughts that we have, and they're very powerful because they literally facilitate our behavior, right? Yeah. So I'm literally thinking about when I went to see my provider for the first time, and I'm like, I don't know if she can help me. She's a civilian. I am in a military family. My husband at the time, he's away. I have this newborn child. I have all these stressors, and I'm a clinician. I'm a mental health provider too. And I had to let all that stuff go because you are your worst enemy, right? You are your worst enemy. You are the one that you're really fighting with.
That raging war within.
Yes.
Yeah.
You are the one that you're fighting with.
Yeah.
But once I got past all of that to say, you know what, I can't. I know for me, I had to hit the point where I could not keep going the way I was going.
Right.
It was to a point, and I'm open book to share, I was going to give up my little boy. The only person that knows that is my mother. I was that far into my depression that I was going to give him up to DHS.
Wow.
It was that bad.
Yeah.
It was that bad. I was thinking about it constantly every day, saying, I can't raise him by myself. I couldn't even see past. I couldn't see past tomorrow.
Right.
I couldn't.
Yeah, I can't say we. I've had that moment when I can't say I wanted to commit suicide, but I really leaned towards like, seriously, like, would anybody miss me? I did the whole check, like, would they miss me? Would they come to my funeral? I mean, like, I think it would be better if I wasn't here. Like, I wouldn't go through this. They wouldn't go through that. No one would have to hear me. I mean, I dwelled in it for, I don't know, for a few hours. I let it go. But it was like, can I get any lower in life? Like, seriously, is there anything lower than this? Like, when you're at your bottom, like, is there any other place other than, because I'm literally, like, laying on my ground. I mean, on my back. Like, I guess there is room underneath my back, so maybe I could get a little bit lower, you know. But how low is low before something good has to come from all of this, you know?
Does.
And it's kind of interesting. Like I said, you know, last month, June was supposed to be mental illness month for me. I was going to talk about that the whole month. Once it came forefront, and I'm sitting here like, wow, what do I do? Like, what do I say? Like, how do I? In my sane mind, I'm thinking, okay, you can do this. But when you're not in the right state of mind, it's easy to tell somebody what you, because you know, if a robber come in my house, I'm going to grab and I'm going to do this. But when they come in your house, your brain does the complete opposite. You know, like, it's easy for me to tell somebody when I'm not in their shoes what to do.
And that's, and for me, that's pretty much for me, in my profession, me reaching people is really, again, I said this before, that human connection is so important. I may not know what it's like to walk in those heavy shoes of yours.
Right.
But I know what it's like to wear shoes.
Yeah.
Right?
Yeah.
Yeah, it's for me, it's the human connection. I've treated people with a variety of different backgrounds. Doesn't matter, money, no money, purple, white, black.
Yeah.
It doesn't even matter. You cut. If I, you cut.
Mental illness does not discriminate.
Basically, if we cut our
same
whatever,
blood,
same blood, same
comes out the same
It doesn't
way.
matter.
No.
It doesn't matter. As long as you have a mind, you are vulnerable. If you don't take care of this up here, I don't care who you are. Yeah. And we've seen that in the news recently, with celebrities. And it's funny, though, because, I think it was Anthony Bourdain, recently Kate Spade, that was brought up a couple weeks back. Mm-hmm. And he was like, oh, man, these people have money, they're wealthy. And I was like, money got nothing to do with it. Money cannot buy you. And it's cliche, but it's so true. Money can't buy you happiness. You could be in a mansion and chilling and still feel like
it's interesting because it just seems like all the rich people at that time when I was coming up in the 60s, 70s, 80s all had money, but they were all getting mental help. Yeah.
It's different. Yeah. When you become aware, I meant to touch on this before, but the interesting thing, when you're aware that you're in a hole and you can't find your way out, you need somebody to give you a light. And that's basically how I look at my profession. I'm giving you a flashlight so you can find your way out. Yeah. It's not my job to, walk you through it. Yeah. It's to be the guide to help you see what it is that you need to see for you to be your best version of yourself. Yeah. That's it. That's basically for me how I looked at it. And someone told me a long time ago that once you become aware of your stuff, it is now your responsibility to do something with it, right? Yeah. Now, if you still got yourself here wherever you don't want to do anything about it, that's your prerogative. but just know that there are consequences, right?
Yeah.
Yes, but it also it's something that's very personal. You tackle it in your own time, and when you're ready to, no one can force you to. But it's good to know that the help is there when you are ready.
Yeah. Yeah. So that is nice to know. Well, like Shara, we have to
Cut it down. I know.
Cut it down. I'm so sorry for all this technical stuff that's been going on. Yes. But I do ask, because this is what I ask for all of our guests, to leave our guests with something positive for us to hit on. So I ask you to relay a positive word for our audience, if possible.
My positive message would be, hopefully you guys out there hearing my story of being a mental health provider and sharing my own struggles with mental health. When I was not diagnosed, the stressors that I had, and making it out to the other side, I'm in such a much better place now because of the people that I reached out to, that there is help out there, that you are not alone with this, and that there's light at the end of the tunnel. No storm stays, it eventually dissipates and goes away, and there is sunshine on the other side of it. So reach out for help. It's there if you need it, and that's my message.
Thank you. I couldn't say it any better than that one. But okay, so I thank you for joining in so much. I appreciate you coming, and gotta come back.
I will come back.
We gotta do a next episode of this. Back. But yes, I thank you.
Maybe see if you guys what topics you want to talk about, and we'll see if we can hash that out.
Okay, thank you.